For 2026, Medicare's Plan Finder tool is rolling out a major update. It now claims to show which doctors and hospitals are in-network for every Medicare Advantage plan. On the surface, this sounds like a huge improvement. Finally, a way to compare plans and see if your favorite doctor or local hospital is covered, all in one place. But there's a big problem. Unfortunately, the provider information on the Plan Finder is often wrong or outdated. Many people are discovering that the doctors and hospitals listed as in-network may not actually accept their plan. You could enroll in a plan thinking your doctor is covered, only to find out later they're not. This can be a devastating surprise, especially if you rely on a specific provider for ongoing care or have built a relationship with your doctor over the years. This mistake could leave you with huge, unexpected medical bills or force you to scramble to find a new doctor at the last minute. For many, this means extra stress and confusion during an already complicated enrollment process. Unlike original Medicare, which lets you see almost any doctor nationwide, Medicare Advantage plans have strict networks. If you go out of network, you could be responsible for the full cost of your care, with no help from your plan. That's why you should never trust the Plan Finder alone when making such an important decision about your health coverage. Always call your doctor's office directly and ask, will you be in network for full plan name in 2026? Don't rely on what you see online. Get confirmation from the source. Only a direct yes or no from your provider can protect you from denied claims, surprise costs, and the headache of switching doctors after you've already enrolled. Remember, original Medicare gives you the freedom to see almost any doctor, but Medicare Advantage limits your choices in exchange for lower premiums and extra perks like dental or vision. The new Plan Finder's errors make it riskier than ever to choose a plan without double-checking every detail. Don't let a website's mistake cost you your doctor or your savings. Take this extra step to avoid costly mistakes, protect your care, and make sure your Medicare plan truly fits your needs for 2026 and beyond. CMS understands that mistakes on the Medicare Plan Finder can have real consequences for people like you, especially when it comes to choosing the right health coverage. These errors can lead to unexpected costs, confusion, and even gaps in your care if you end up with a plan that doesn't actually meet your needs. That's why for 2026 there's a special, one-time special enrollment period, also called an SEP, designed to help you if you're affected by these Plan Finder mistakes. Here's how it works. If you use the Plan Finder to pick a Medicare Advantage plan, but later discover your doctor or specialist isn't actually in network, you're not stuck. You'll have a full 3 months from the start date of your new plan to make a change. Just call 1-800-MEDICARE, explain the situation, and ask for the special enrollment period. The representative will guide you through the process and answer any questions you might have. Be ready to provide your current plan information and the name of the provider or doctor you need to see, so Medicare can verify the error and help you move forward. Once your SEP is approved, you'll have the chance to switch to a plan that actually covers your doctor. Or you can return to original Medicare and sign up for a Part D prescription drug plan if you need one. Remember, this SEP is your safety net for fixing a Plan Finder mistake, but you must act quickly. Don't wait, because the 3-month window goes by fast, and you need to contact Medicare directly to use this opportunity. Don't miss your chance to correct a costly error and make sure your Medicare coverage truly works for you. The Medicare market is shrinking in 2026. Major insurers are dropping plans and leaving some areas. Fewer choices mean more people scrambling for coverage, and premiums for Part D drug plans are rising. The out-of-pocket cap for prescriptions is also going up, so you'll pay more before full coverage kicks in. Many Medicare Advantage plans are cutting dental, vision, and other perks to save money. Read your annual notice of change letter carefully. It details all cost and benefit changes for 2026. Don't let your plan auto-renew without reviewing your options. With fewer plans and higher costs, active comparison shopping is essential to protect your health and wallet. Don't just check with your doctor. Take time to carefully review your plan's drug list, also known as the formulary. Many people assume their medications will be covered, but plans can change their lists every year, sometimes without much notice. If your medication isn't covered or if it's moved to a higher tier, your out-of-pocket costs can skyrocket unexpectedly. Even a small change in the drug list can mean paying hundreds more each year, so it's important to double-check before you fill your next prescription. Also, make sure your pharmacy is in the plan's preferred network. Using an out-of-network pharmacy can lead to much higher prices, and sometimes your insurance may not pay at all. Scrutinize extra benefits, too. For example, dental coverage may sound great, but it often only covers basic cleanings and exams. Major dental work, like crowns or dentures, might not be included, and annual limits can be surprisingly low. The Medicare Plan Finder tool is helpful, but it may not show all these important details. Always read the plan's official documents and summary of benefits before enrolling so you know exactly what's covered and what isn't. Policy changes may also affect eligibility for some non-citizens, and new rules could delay financial aid improvements for low-income seniors. These changes can be confusing and may impact your access to care or assistance. With all these shifts, it's more important than ever to review your coverage each year and seek expert help if you're unsure about your options or benefits. Don't get caught off guard by hidden costs or sudden eligibility changes. Stay informed and protect your health and finances. Medicare is more complicated than ever, but you don't have to go it alone. Your local state health insurance assistance program, SHIP, offers free, unbiased counseling to help you compare plans and verify provider networks. If you have limited income, ask about extra help for Part D drug costs. Many eligible people aren't enrolled. Use your official Medicare and You 2026 handbook as a reliable reference. Don't trust ads or even the Plan Finder without double-checking. Call your doctors, check your drug list, and read the fine print. Reach out to SHIP for personalized guidance. By being proactive and using trustworthy resources, you can avoid costly mistakes and get the coverage you deserve.